Good morning, everyone, and thanks for joining us for today's virtual press conference. This press conference is being recorded and can be provided to you upon request. As a reminder for our callers, please be sure to mute your line. For those joining us by video, please set your GoToMeeting view option to view who's talking. At the conclusion of today's press conference, there will be an opportunity to ask questions. Please use the chat feature within GoToMeeting to let us know you have a question, and we'll be sure that your question is asked. Thank you again for joining us. And I'll now turn it over to Zach Schamberg, President and CEO of the Pennsylvania Healthcare Association.
Thanks, Shana. Good morning, everyone, and thank you for joining us. I am Zach Schamberg, and I am the President and CEO of the Pennsylvania Healthcare Association. I'm proud to be joined this morning by two of the state's leading long-term care advocates. And before we get to our collective announcement, I'd like to provide you with an update on the state of long-term care in Pennsylvania. Surely by now, you've seen the rising case numbers throughout the Commonwealth. On an almost daily basis, we continue to set new records as it relates to the increasing number of confirmed cases of COVID-19. And that is a serious concern to long-term care providers, including our nursing homes, our personal care homes, and our assisted living communities. The independent research that we've seen, be it from Brown, Harvard, or the University of Chicago, is very clear. The spread of COVID-19 in our communities equals a greater likelihood of spread in our long-term care facilities. And that, unfortunately, has proven to be very true throughout the last few weeks. Resident cases in long-term care are on the rise. Staff cases in long-term care are on the rise. And hospitalization rates, while not quite what they were at the beginning of the pandemic, are beginning to increase once again. In short, we are beginning to come full circle in our fight against COVID-19. It's important to note that long-term care providers have been at the epicenter of this pandemic since mid-March. And even before the virus made its way to Pennsylvania, our organizations were in communication with our counterparts in Washington state, where the first cases of COVID-19 were reported in a nursing home, the Kirkland Life Care Center. Since those early days, the numbers and the data that have emerged have been clear. Nearly 70% of all COVID-19 related deaths in Pennsylvania have occurred in long-term care facilities. And well over 1,300 facilities statewide have reported at least one positive case. Nationwide, more than 100,000 deaths have occurred in long-term care among both staff and our residents. Today, 9 months into this fight, providers are faced with the question of sustainability. How much longer can they continue to mitigate the spread of COVID-19? How much longer can they work to keep their residents and their staff safe? When will a vaccine be approved? And will it be prioritized to those who need it most in Pennsylvania? Throughout these past 9 months, our organizations have been the voice of those providers and those workers on the front lines and the residents they care for. When our healthcare heroes were not being heard in April, in May, and in June, we called out for PPE, or personal protective equipment. We called out for more testing capabilities and critical staffing support. But today, a recent survey of our members has yielded troubling results. PPE is once again running low. Masks, gowns, gloves, and goggles are once again in short supply. As it relates to testing, with nearly 60 of Pennsylvania's 67 counties recording positivity rates higher than 10%, capacity is once again an issue. Results are lagging and labs are overworked. And staffing, when I speak with providers about their workforce, I continually hear three words: burnout, fatigue, and exhaustion. We fear a mass exodus may be coming. We fear that long-term care workforce, our workforce, is not as robust as it needs to be to care for our aging population. Again, in short, we've come full circle as it relates to the critical needs of long-term care. Another issue that has never faded from the forefront of this struggle is funding. We've warned about it for years. The underfunding of the state's Medicaid program and the need for long-term investment in long-term care. In late May, the state took a very important step. They allocated $245 million in Emergency CARES Act funding that was mandated by the federal government directly to nursing homes so that they could procure the PPE that they needed, so that they could continue to test their staff, and so that they could continue to keep their healthcare heroes coming to work each and every day. That funding was important, but it was only one component of the promise our federal government made to providers. Arguably, one of the most predominant themes to emerge from this pandemic has been the need for collaboration between long-term care and state government on all issues, including the funding for our providers. For months, our groups have asked for partnership. Instead, we're here this morning with an important announcement. I'd like to now introduce Adam Marles, the President and CEO of Leading Age PA. Adam.
Thanks, Zach. And thank you everyone for joining us today. Again, my name is Adam Marles. I'm President and CEO of Leading Age PA. My last name is spelled Marles. I appreciate being here with Zach and Chase in a united effort to stand up for nursing home providers, the brave professionals who work there every day, and most of all, those they serve, the residents and their loved ones. These are trying times for everyone. And Governor Wolf has simply turned his back on these remarkable Pennsylvanians in direct violation of state law. As such, we filed a lawsuit against the administration. To be clear, we didn't want to file suit against the Wolf administration, but when they ignore the clear language of state law and essentially steal more than $153 million from nursing homes battling a once-in-a-century pandemic, it's time to stand up for what's right. This year, the Families First Coronavirus Response Act, or the first federal stimulus, specifically increased federal dollars to help fight the COVID-19 pandemic. Specific to this lawsuit, it increased funding to nursing homes in support of the Medicaid program, and state law demands that these dollars be given to providers. They have not. For nursing homes in Pennsylvania, this enhanced funding equals approximately $153 million that was to be directed to providers during 2020, along with continuing funding enhancement for as long as the federal emergency declaration continues. Despite clear state law, the administration has refused to pay what is due for 2020, as well as anything moving forward. Our associations have negotiated diligently with the administration for months, hoping that they would do the right thing and provide these funds to nursing homes. They've refused. Lawmakers specifically designated this funding to help those reeling under the financial costs of this ongoing pandemic. The Wolf administration simply cannot ignore the law and reappropriate funds to fill holes in the state budget. When this pandemic started, nursing homes were already well behind in having the resources necessary to wage this battle. It's important to reemphasize that many nursing homes were already in crisis due to chronic Medicaid underfunding. An overwhelming percentage of residents rely on Medicaid, yet Pennsylvania has flat funded our system for nearly a decade while costs have skyrocketed. Now, as our Commonwealth experiences a second surge of COVID, this funding is critical and will save lives. Our facilities are trying to survive at the epicenter of this pandemic. It continues to be mystifying that the Wolf administration continues to ignore state law and this desperate need. Let me be clear. This is not litigation to compel the administration to provide additional funding to nursing homes at the expense of others trying to protect people during the pandemic. We are defending nursing homes as the administration redirects funds that the law clearly states are due to them. Speaking on behalf of Leading HPA, we intend to fight to ensure the administration complies with the law so our providers have the resources they need to save lives. It's now my pleasure to introduce Chase Cannon, Executive Director of the Pennsylvania Coalition of Affiliated Healthcare and Living Communities.
Thank you, Adam. My apologies. It seems that the camera video is not working. I hope everybody can hear me. I want to thank everybody for joining us today. As Zach and Adam have already stated, yesterday's actions were unavoidable. After months of negotiations with the Department of Human Services with no resolution, our organizations felt we had exhausted all other resources and that the action of filing a lawsuit was the only option left. As Adam pointed out, it's important to note that the resolution we seek from the court is entirely meant to support long-term care communities and residents. We are experiencing unprecedented times with the COVID-19 pandemic. To accept resources from the state or from the Commonwealth that don't equal what the law provides would mean we're ignoring not only our respective duties to each of our organizations, but each and every long-term care resident in Pennsylvania. The funds in dispute go towards many things that provide protections to long-term care residents, such as personal protective equipment, enhanced infection control protocols, and even additional staff. To ask these facilities to do with less right now is just unimaginable. The residents of Pennsylvania's long-term care communities are some of the most vulnerable to COVID-19. And in the case of my organization's members, that are made up of county nursing homes, primarily made up of county nursing homes, PHCA members care for residents that consistently have fewer resources than others. Without receiving all the resources that the law provides, these facilities and their residents will struggle significantly more to fight COVID-19. Again, we are saddened that it had to come to this, but we refuse to let the resources that are rightfully our members be taken. In the end, we hope that this lawsuit will result in long-term care communities of Pennsylvania receiving what the law requires, and that each long-term care community will be able to provide care to all who need it. Again, I just want to thank everybody for attending this press conference today. I believe we're going to open the call up for any questions. So again, thank you, and thank you, Adam and Zach, for your leadership on this issue.
As a reminder, please submit your questions using the chat feature, and we will ensure your question is asked. We'll give folks a moment to submit that. We have a question from the AP. The lawsuit says that Pennsylvania basically diverted funding from other state programs. Is that correct?
No, I believe what the lawsuit says is that the state appears to have diverted funds that came through the Families vs. Coronavirus Act, as we stated earlier, to other programs, or conversely, they directed those funds to nursing facilities, but then diverted funds that ordinarily would have been going to nursing facilities to other programs within the state. It's unclear to us exactly how the funds have been used. There hasn't been any clarity from the state on that, but it's clear that the funds that were specifically directed to nursing homes have not been delivered to them in part or in full.
Thanks, Adam. We have another question from Spotlight PA. What reasoning has the state given the associations for not releasing the funds? As a follow-up, if these are Medicaid funds, shouldn't they be tied to those facilities and individuals in those facilities?
Yeah, and I can ask, and Jamie, thank you for your question, and thanks for joining us today. I can answer the first part of that question. Again, it's not about the state not releasing the funds. These funds have been released. They've been collected by the Department of Human Services and the Wolf administration, but unfortunately, they haven't been sent to where they need to go and who deserves them most. That's the long-term care providers, and that's our long-term care residents and workers. So the states have, or the funds have been allocated by the state. Unfortunately, they've been allocated to other organizations, other parts of the Medicaid budget, and long-term care providers have yet to see a single dollar from these enhanced FMAP funds.
We have another question from Penn Live.
I'm sorry, Shannon, just before we move on to the next question, that just to follow up on the reasoning that we've heard from the state, it hasn't been clear. The closest we've heard has been that the state is short on funds and they need to use them to assist with that issue. But we haven't been given any specificity in terms of the utilization of those funds.
Thanks, Adam. We have another question from Penn Live. Can you offer some more specifics as to what your facilities or their residents have had to do without as a result of not receiving this funding?
Sure, I can start, and Adam and Chase, please feel free to jump in. But again, I mentioned in my opening, what we're concerned with now is sustainability. We're starting to see nursing homes specifically around the state look to sell, reorganize. In the case of Charles Morris out in Western PA, even just shut down and close their doors altogether. Without these critical funds that, again, were promised by the federal government and by state law to providers, folks on the front lines have been unable to procure the PPE that they need, the masks, gowns, gloves, and goggles. They're unable to keep up with testing, whether it's once a month, once a week, or twice a week. And they're unable to invest in their staff, to hire more staff and to recruit or to keep staff and retain those who are working in the building already. Really, it's the critical needs of this sector to continue mitigating the spread of COVID-19 until a vaccine gets to Pennsylvania and to continue to keep their residents and staff safe.
Yeah, and just to reiterate what Zach said a little bit, prior to the pandemic, as we said, there's been chronic underfunding of the medical assistance program in Pennsylvania. That was compounded by the pandemic. And to not make sure that funds that were specifically allocated by the federal government get to nursing homes in Pennsylvania while they're trying to stay alive. As Zach said, we've got closures and sales that are occurring both due to reasons prior to the pandemic and being accelerated because of the pandemic. The funds need to get to nursing homes quickly before we see more great providers close their doors.
And this is Chase. One thing I would add, just to keep everybody, just to note, those initial federal stimulus funds should have already been spent by the end of the year. We're getting into a new 2021 year here, and hopefully a vaccine's coming very soon, but those funds for 2021 are going to be much needed, just due to the threats and the protocols that the facilities are being asked to implement for the foreseeable future. Like Zach and Adam said, sustainability right now is probably the biggest issue we're facing.
Again, as a reminder, if you have any questions, please feel free to submit them using the chat feature, and we'll ensure that your questions are asked. It looks like those are all the questions that we have coming today. If you have any additional questions, please feel free to reach out to the organizations that are listed on the screen. We'll be happy to field any additional questions that you might have. There will be a follow-up release that will be provided to you at the conclusion of this press conference that will include a link to the final lawsuit that was filed yesterday. Again, if you have any questions, please feel free to reach out directly to the organizations listed on the screen. And thank you again for joining us today.